Hello friends, today we will be discussing about FUT or follicular unit transplant. This is a traditional method of hair transplantation and still it holds a very important place in a hair transplant clinic. As far as FUT is concerned, what's the method, how we do that? A strip is taken from back of your head and then that strip is dissected into individual follicular units under microscope, and then these individual follicular units are implanted in the recipient area. So the method of implantation in FUT and FUE is exactly the same. Now, talking about the advantages of FUT procedure. The first advantage is that the entire procedure of extraction is done under microscope. So this is really good because you can see the roots. The roots are directly visible, unlike FUE. So the chances of getting intact grafts which are not damaged are more in FUT as compared to FUE. You need to have operating microscopes and a team of trained technicians who can dissect follicular units from that. Now the second advantage of FUT procedure is number of grafts. We can have a huge number of grafts from a single strip as compared to FUE where we get less number of grafts. So this is a major advantage, especially when we are doing patients who have high grade of baldness. Now another advantage of FUT surgery is the quality of grafts. The quality of grafts is really good as they have fat tissue in it and the survival rate of these grafts are more. Now another advantage of FUT procedure is the area from which we are doing extraction. So FUT procedure is done from this region here, and this region is the most permanent zone which is never affected by thinning of androgenetic alopecia. In the other procedure we have to take out grafts from a little above that and little below that, which is subjected to thinning. Another advantage of FUT surgery is the scar. Actually, the scar which is there in FUT is a linear scar. Maybe 2 or 3 times by including the scar of previous surgery in the next surgery. So we end up having only one scar. As you can see in this patient where we did a surgery, we had already done an FUT, you can see the scar of his previous surgery is barely visible, it's hardly visible, and we included the scar of that surgery in the next surgery in this patient because of 2 FUT surgeries. First time we got 3000 grafts from his FUT, second time we got 2800 grafts from his FUT, we got almost 6000 grafts by FUT alone, which is a real good number as you can see in the results. The crown area, the front area, everything is so nicely covered. Another advantage of FUT surgery is that the surgery can be done without shaving off the head completely. Like if we have to do say 1500 or more grafts in FUE, you have to shave off the entire head. But in FUT, we can even get 3000, 3500 or even up to 4000 grafts without shaving off the head, which really minimizes the social downtime. And as you can see in this patient, we did an FUT surgery, so the scar is barely visible, we didn't shave off head, so even day 1 nothing was visible, and this actually matters a lot when patients don't want other people to know that they have undergone a surgery. Another advantage of FUT surgery is versatility of grafts. Now in FUT we get consistent single unit grafts, 2 unit, 3 unit, so we get the whole spectrum of grafts in FUT. Unlike FUE where we get sort of monotonous grafts. This is really important because we need consistent single unit grafts while we are doing the hairline and the temples. This is very important, and as you can see in these patients where we did the temple area and we did the frontal hairline with single unit grafts, which are little hard to come in FUE. If you see this patient, this is a case of traction alopecia because of turban, and you can see the hair is thick, good quality, the density was good. So we did one surgery, FUT, which gave us 4,000 grafts in one go. So we didn't shave off his head, we just took out the strip from back of his head and we did 4,000 grafts in one day. We cannot get that many grafts with FUE. Now if you see this patient, the temple area, the hairline, we use single unit grafts, which really looks awesome, and the coverage is very dense. Now if you see this patient, another patient here, he had curly hair. So if the patient is having curly hair, the hair curls inside the scalp. So if we are doing an FUE procedure in a patient having curly hair, the chances of getting transected roots are more. While if we are doing FUT in such a patient, then we get to see the grafts under the microscope, and then the chances of getting transected root are very minimal. So in African patients also, or in Asian patients where we have curly roots, the method of choice is always an FUT procedure. So there are so many reasons why FUT is so important and still holds a very important place in a hair transplant clinic. I think every individual has unique needs, and according to the individual case, we should choose the method. In some patients, FUE fits better, in some patients, FUT fits better, and finally, the decision should be taken by the patient himself. Our job is to just make him understand the advantages, pros and cons of both the procedures. I'll be coming up with few more videos where we will be discussing each and every final details. So if you want more information on FUT and FUE, subscribe to our channel. You can also follow me on Facebook and Twitter. Thank you. Love yourself. Stay blessed.